Good morning, ma'am. I am Jomer Cordero from College of Business and Management, major in Office Administration. In line to our course in medical procedures, I am here to interview you to learn more about your experience in the medical field. Will you please introduce yourself, ma'am?
Good morning, Jomer. I am Karen Paloma, a company nurse and the Safety and Health Manager of Roy Plaza Corporation.
Okay, ma'am, let's start. So question number one. How would you describe your primary duty as a medical administrative employee?
A company nurse is also called an occupational health nurse. My job is to provide basic healthcare services to employees. I am responsible for assessing exposure risks, aiding employee recovery, promoting health, maintaining health records, giving first aid and administering prescribed medication and treatment, assisting injured and sick employees, evaluating employees' overall health, and raising healthcare awareness programs.
Okay, ma'am. Question number two. How do you protect patients' rights and adhere to healthcare confidentiality requirements?
In healthcare, we adhere to the Magna Carta of Patients' Rights in the Philippines. We have 12 Patients' Bill of Rights. In general, it is to safeguard a patient's right to accurate and complete information, fair treatment, and self determination when making healthcare decisions. Patients should expect to be treated with sensitivity and dignity and with respect for their cultural values. Adhering to the patient's right to privacy and confidentiality creates a trusting environment and encourages the patient to cooperate, seek care, and to be as honest as possible during the course of a healthcare visit.
Thank you, ma'am. Question number three. What communication skills have you acquired which help you when working with patients?
Communication is vital in healthcare. A nurse must acquire a set of therapeutic communication skills in order to build rapport and trust with its patients. These are verbal and nonverbal techniques to help patients understand their condition or situation. Let's say, for example, a patient who is introverted and very reserved will be difficult to probe and extract its medical history, which is necessary for making an appropriate nursing care plan. We have to allow time to communicate with the patient. And therapeutic communication encourages patients to verbalize feelings such as fear and distress.
Okay, ma'am. Question number four. What would you like? What would you do if the physician asked you to handle an administrative task and one of the nurses requested assistance with the patient at the same time?
Our patients' health and safety is always a priority, an important part of healthcare. This reduces negative health outcomes. Having to say that, I will obviously respond to the patient that needed assistance. An administrative task is equally important to the overall welfare of the patient. But healthcare prioritization will then take place, and we call it triage. Basically, it is assessing the importance, urgency, effort, and resources required for each one.
Let's proceed to question number five, ma'am. Do you have experience taking patients' histories and can you do this electronically?
Yes, I always take the time to get my patients' medical histories. Taking a patient's past medical history is important to understand the state of health of the patient further and to determine whether the history is related to any acute complaints to direct a medical professional a diagnosis. A patient's medical chart composed of documents that contains the patient's active and past medical history including medical conditions, laboratory results, treatments, and more. But because of technological development, this gave birth to the electronic medical record or the EMR. It is an electronic health record of health related information of a patient. It is basically the digital version of the paper chart.
Thank you, ma'am. The question number six. When answering a patient's question, what is the main thing you are trying to accomplish?
A good nurse patient relationship is beneficial to the provision of overall quality of healthcare services. It is important to first create a safe environment for the patient to express his or her needs. Additionally, nonverbal communication behaviors such as eye contact and listening attentively may likely increase patient confidence and satisfaction. The goal here is really connecting and interacting to better understand a patient's needs.
Proceed to question number 7. Have you ever encountered issues with patient's record? If so, how were they resolved?
Yes, I have encountered a few. Hospitals now adapt and use electronic medical records, and in my workplace, which is in the business sector, unfortunately, our health records are stored and filed in the traditional paper charts. This employee health record is kept and stored in a safe and secure cabinet where it is kept confidential. One problem with paper document is that it may take time to retrieve records. Also, it is prone to deterioration as paper gets oxidized through time and may get wet, torn, and crumpled. This can also be prone to breaches in privacy and confidentiality as papers can be easily passed and unauthorized people can have access to. Therefore, I came up with a solution to apply the principle of redundancy with utmost care. Aside from paper, I encoded every employee's health records in the computer and uploaded it in the Google Drive where it is only I who can have the access to. This is to maintain medical data privacy.
Last question, ma'am. Question number 8. What are the necessary topics or things in the medical field that the office administration student must know?
The importance of data privacy. Breaches of privacy and confidentiality not only may affect a person's dignity, but can also cause harm. This can result in stigma, embarrassment, and discrimination.
Thank you very much, ma'am, for the time and the knowledge you've shared to me. That's
You're welcome.